The word hemodialysis simply means blood separation or filtration. It's a way of separating the waste from your blood and removing it. There are three main parts to the treatment: vascular access, the dialyzer, and the dialysis machine. Haemodialysis is usually performed 3 to 4 times a week, so it's important to find a reliable place to access your blood supply on a regular basis. There are 3 ways to do this. The fistula is where you insert the needles to remove your blood for cleaning. A surgeon creates a fistula by connecting an artery directly to a vein, frequently in the forearm. This causes more blood to flow into the vein. As a result, the vein grows larger and stronger, making repeated needle insertions easier. It's normally a day surgery procedure, then the fistula takes about 6 weeks to mature and be ready for use. A fistula is less likely to become infected or form clots, and will usually last longer than other types of vascular access. A graft is used if your blood vessels are not strong enough to make a fistula. A synthetic tube is implanted under the skin, usually in the arm, to connect an artery to a vein. This tube can then be used repeatedly for needle placement. Grafts are ready for use within a couple of weeks, however they tend to have more problems with clotting and infection and will need replacement sooner. The catheter is a soft plastic tube containing 2 smaller tubes. It's placed into a large vein in your chest. This method has the greatest risk of infection and clotting. A central venous catheter is only used in a small number of people and is usually a temporary measure. The dialyzer is a filter that removes waste from your blood. It's a circular tube filled with thousands of hollow fibres. The walls of these fibres have tiny holes in them. The blood travels through the fibres in one direction, while dialysis fluid flows through the gaps between the fibres in the opposite direction. The pressure and concentration of the blood is greater than that of the fluid. This imbalance draws the blood toward the dialysis fluid. However, the tiny holes in the fibres will only permit some elements like water and small waste molecules to leave, while important larger elements like blood cells and most proteins are blocked. As the wastes pass into the dialysis fluid, the contaminated fluid is flushed away to a drain, and the clean, filtered blood is returned to your body. Only about a cup of your blood is outside your body at any one time. However, over the course of a dialysis session, your entire blood supply of around 4.5 litres will pass through the dialyzer about 20 times, with a little more waste removed at each pass. By the end of each treatment, up to 70% of the wastes in your blood may have been removed. The whole process is closely monitored by your dialysis machine. While there is more than one type of machine, they all do the same job, whether in a hospital or at home. People have been doing home dialysis for nearly 50 years, but new, smaller machines have made dialysis at home much easier. The dialysis machine pumps your blood to the dialyzer to be cleaned and returns it to you, monitoring the whole process. It checks things like blood, flow pressures, temperature, and mixture of the dialysis fluid. It has numerous safety features and will sound alarms to let you know if something needs to be checked. It even alarms when it's finished. Dialysis machines require electricity and a reliable water source, and are installed in your home free of charge. The first step for the patient is to prepare the equipment they will need. Set up the lines, the dialyzer and the dialysis fluid. They'll weigh themselves and take their blood pressure and use these results to program the machine. For example, their weight will tell them how much fluid they've built up in their blood since their last treatment, and therefore how much fluid the machine will need to remove to return their weight to normal. A drug called heparin is fed into the lines to prevent the blood from clotting. The patient inserts their needles and connects to the machine. Then it's a simple matter of sitting back for 4 to 5 hours while the dialysis process takes place. Each patient will have different needs, but usually the hemodialysis treatment will last for around 4 to 6 hours, about 3 days a week, or for around 8 hours at night while a person sleeps. When the process is complete, a saline solution is fed through the machine to clear the lines of blood. The patient disconnects, removes the needles, and dresses the needle site. The home dialysis patient first learns to do treatments in a home training unit, working with dialysis staff. For some, the big downside is the needles, but most patients get used to these. Another is being tied to a machine for long periods of time. A big advantage with home dialysis is that you can choose treatment times to suit your lifestyle, and no travelling is required if the treatment is done at home.